Clomid, also known by its generic name Clomiphene citrate, is one of the most commonly prescribed fertility medications. It belongs to a class of medications called selective estrogen receptor modulators, or SERMs. Clomid is primarily prescribed to women who have difficulty ovulating naturally. Unlike some fertility treatments that require injections, Clomid is conveniently taken as an oral tablet. Due to its effectiveness, safety profile, and convenience, Clomid is typically the first treatment option doctors recommend before considering more invasive or expensive fertility procedures. Now that we understand what Clomid is, let's continue our exploration of this important fertility medication. Anovulation is the failure to release eggs from the ovaries. Let's compare normal ovulation to anovulation. In normal ovulation, a mature follicle releases an egg from the ovary. In anovulation, this egg release fails to occur. Anovulation is a common cause of infertility. Without egg release, pregnancy cannot occur, even if other reproductive functions are normal. Clomid is specifically designed to address anovulation by stimulating the ovaries to develop and release eggs in women who don't ovulate regularly or at all. Normal ovulation is regulated by a complex hormonal feedback system involving the hypothalamus, pituitary gland, and ovaries. The process begins in the hypothalamus, which secretes gonadotropin-releasing hormone, or GnRH. GnRH travels to the pituitary gland, stimulating it to release follicle-stimulating hormone and luteinizing hormone, known as FSH and LH. FSH and LH then travel to the ovaries, where they stimulate the development of follicles containing eggs. As follicles develop, they produce estrogen, which feeds back to both the hypothalamus and pituitary. During a normal menstrual cycle, a follicle develops over approximately 2 weeks. When the follicle reaches maturity around day 14, it ruptures to release an egg in a process called ovulation. Throughout the menstrual cycle, hormone levels change in a predictable pattern. FSH rises early in the cycle, stimulating follicle development. Estrogen rises gradually as the follicle grows, providing negative feedback to the pituitary. When estrogen reaches a critical level, it triggers a surge in LH around day 14. This LH surge causes ovulation, the release of the mature egg from the follicle. The menstrual cycle involves both negative and positive feedback loops. Initially, the hypothalamus releases GnRH, which causes the pituitary to release FSH and LH. As estrogen levels rise, they provide feedback to both the hypothalamus and pituitary. For most of the cycle, estrogen provides negative feedback, inhibiting GnRH, FSH, and LH. However, when estrogen reaches a critical level mid-cycle, it suddenly switches to positive feedback, triggering the LH surge that causes ovulation. Understanding this delicate hormonal balance is essential for understanding how fertility medications like Clomid work. To understand how Clomid works, let's first review the normal hormone feedback loop in the female body. The hypothalamus produces GnRH, which stimulates the pituitary gland to release FSH and LH. FSH and LH then stimulate the ovaries to develop follicles and produce estrogen. Estrogen provides negative feedback to the hypothalamus and pituitary, reducing GnRH, FSH, and LH production. Clomid works by binding to estrogen receptors in the hypothalamus and pituitary gland. However, unlike estrogen, Clomid does not activate these receptors. Instead, it blocks them. By blocking estrogen receptors, Clomid tricks the body into thinking estrogen levels are low, even when they're normal. Without the normal negative feedback from estrogen, the hypothalamus increases GnRH production. This increased GnRH causes the pituitary to release more FSH and LH than it normally would. The higher levels of FSH and LH stimulate the ovaries to develop multiple follicles simultaneously. This follicle development significantly increases the chance of successful ovulation, even in women who weren't ovulating regularly. To summarize, Clomid's key mechanism is blocking estrogen receptors, which leads to increased hormone production and ultimately stimulates ovulation. Let's understand a typical Clomid treatment cycle. Clomid is typically taken for 5 consecutive days, starting on day 3, 4, or 5 of your menstrual cycle. After completing the medication, ovulation usually occurs 5 to 10 days after the last pill. Let's visualize this on a menstrual cycle calendar. Starting with day 1 of your cycle, which is the first day of menstruation, Clomid is typically taken from days 3 through 7. After completing the 5-day course of Clomid, ovulation is expected to occur between days 12 and 17 of your cycle, which is approximately 5 to 10 days after your last pill. There are variations in Clomid treatment protocols. While days 3 to 7 is common, some doctors may prescribe it for days 5 through 9 instead. The typical starting dose is 50 milligrams daily, but this can be increased to 100 or 150 milligrams if needed. Treatment may continue for up to 6 cycles. Throughout your treatment cycle, your doctor will monitor your progress through blood tests that measure hormone levels such as estradiol, luteinizing hormone, and progesterone. Transvaginal ultrasounds may also be performed to track follicle development. Monitoring typically begins around day 10 to 12 of your cycle. Based on these results, your doctor may recommend timed intercourse or intrauterine insemination to maximize your chances of conception. These monitoring methods help determine if the treatment is working effectively and guide the timing for conception attempts. Clomid is widely used as a fertility treatment, but how effective is it? Clinical studies show that approximately 80% of women will successfully ovulate when taking Clomid. However, ovulation doesn't always lead to pregnancy. About 40 to 45% of women will achieve pregnancy within 6 cycles of treatment. The likelihood of success varies by treatment cycle. The second cycle typically shows the highest success rate at around 25%. Success rates tend to decline with each additional cycle beyond the second cycle, with diminishing returns after cycle 4. Several important factors influence the effectiveness of Clomid treatment. Age is one of the most significant factors, with women under 35 experiencing higher success rates. The cause of infertility also matters. Women with polycystic ovary syndrome, or PCOS, typically respond better to Clomid than those with other causes of anovulation. Additional factors include sperm quality and count, endometrial thickness, and the presence of other fertility issues such as tubal blockages. Age has a significant impact on Clomid success rates. Let's look at how pregnancy rates vary across different age groups. Women under 30 have the highest success rates at approximately 45%, while rates decline to around 12% for women over 40. Let's summarize the key points about Clomid's effectiveness. While about 80% of women will ovulate on Clomid, only 40 to 45% will achieve pregnancy within 6 treatment cycles. The second cycle typically shows the highest success rate, with diminishing returns after 3 to 4 cycles. Age is a critical factor, with significantly better outcomes in younger women, and patients with PCOS tend to respond better than those with other causes of infertility. Clomid treatment may cause several side effects due to the hormonal changes it induces. Physical side effects are the most common. Many patients experience hot flashes similar to those in menopause. Nausea, breast tenderness, and headaches may also occur. Emotional symptoms like mood swings and irritability are also frequently reported, as hormonal fluctuations can affect neurotransmitter levels. While most side effects are mild, visual disturbances are a rare but serious side effect that require immediate medical attention. These may include blurry vision, seeing spots, or flashes of light. It's important to know that most side effects are mild and temporary, typically resolving once treatment ends. Side effects usually appear within the first few days of taking Clomid, and only about 10 to 20% of patients experience noticeable side effects. While Clomid is an effective treatment for anovulation, there are several important risks and considerations to be aware of. One significant risk is the increased chance of multiple pregnancies, primarily twins. This occurs in approximately 5 to 8% of Clomid pregnancies. Another potential risk is ovarian hyperstimulation syndrome, or OHSS. This occurs when the ovaries become swollen and painful due to excessive stimulation. Symptoms can include abdominal pain, bloating, nausea, and in severe cases, shortness of breath. Fortunately, severe OHSS is rare with Clomid compared to other fertility treatments. Clomid may also lead to the development of ovarian cysts. These fluid-filled sacs form when follicles grow but fail to release an egg. In most cases, these cysts are asymptomatic and resolve on their own within a few menstrual cycles. However, if they become large or painful, treatment may need to be paused. Clomid is typically not used for more than 6 treatment cycles. This limitation exists for several important reasons. Extended use beyond 6 cycles is not recommended due to diminishing effectiveness, increased risk of side effects, and some studies have suggested a potential link to ovarian cancer with long-term use. The effectiveness of Clomid tends to decrease with each successive treatment cycle. If pregnancy hasn't occurred after 6 cycles, alternative treatments should be considered. Understanding these risks and considerations is essential for making informed decisions about Clomid treatment. Always discuss these factors with your healthcare provider. Monitoring the progress of Clomid treatment is essential to determine its effectiveness and optimize timing for conception. Ultrasound monitoring is a key method to track follicle development. Transvaginal ultrasounds are performed every few days during the treatment cycle. The doctor measures the size of developing follicles. A mature follicle typically reaches 18 to 25 millimeters before ovulation occurs. This helps confirm that Clomid is stimulating proper follicle growth. Blood tests are crucial for monitoring hormone levels throughout the treatment cycle. Doctors measure several key hormones to assess if Clomid is working effectively. Estradiol, produced by developing follicles, indicates follicular growth and development. Luteinizing hormone, or LH, confirms that an LH surge has occurred, which triggers ovulation approximately 24 to 36 hours later. Rising progesterone levels after ovulation confirm that ovulation has successfully occurred and the corpus luteum is functioning properly. At-home ovulation prediction kits are valuable tools for patients to monitor their own cycles between clinical visits. These tests detect the luteinizing hormone surge that occurs just before ovulation. Patients typically begin testing around day 10 of their cycle and continue until a positive result. A test is considered positive when the test line becomes as dark as the control line, indicating an LH surge. This usually means ovulation will occur within the next 24 to 36 hours. All monitoring methods work together to determine the optimal timing for conception attempts. Based on monitoring results, your doctor can pinpoint when ovulation is likely to occur. The optimal time for intercourse or insemination is typically in the window 1 to 2 days before ovulation. Ultrasound confirms a mature follicle, blood tests detect the hormone surge, and at-home tests can indicate when ovulation is imminent. In some cases, doctors may recommend a trigger shot of human chorionic gonadotropin to precisely time ovulation. Comprehensive monitoring throughout Clomid treatment ensures the correct dosage is used, confirms that the treatment is effective, helps with optimal timing for conception attempts, and allows for early detection of any potential complications. While Clomid is often the first-line fertility treatment, it's important to know when to consider alternative options. Typically, doctors recommend trying Clomid for 3 to 6 menstrual cycles. If pregnancy doesn't occur after this time, it's usually a decision point to consider other fertility treatments. There are several important reasons to consider moving on from Clomid treatment. Let's look at the main alternative treatments that might be recommended after Clomid. Injectable gonadotropins are stronger fertility medications that directly stimulate the ovaries to produce multiple follicles. Intrauterine insemination, or IUI, involves placing specially prepared sperm directly into the uterus and is often combined with fertility medications. In vitro fertilization, or IVF, is a more advanced treatment where eggs are retrieved, fertilized in a laboratory, and the resulting embryos are transferred to the uterus. Fertility treatment typically follows a progression from less invasive to more complex options. It's important to remember that Clomid is often just one step in a fertility treatment journey. Many patients who don't succeed with Clomid alone go on to achieve pregnancy with other treatments. Work closely with your fertility specialist to determine the best time to move on to alternative treatments based on your specific situation.